Hello, welcome to the audio lecture for chapters 4 and 5. We're going to continue with our conversation from chapters 1, 2, and 3. This is for U.S. Healthcare Delivery Services. And in chapter 4, we're going to talk about the organization of the health services system. And in chapter 5, we'll talk a little bit about management in the health services system. I will tell you these slides are pretty short. That is because the chapters are not as long. There's not anything that I'm going to mention that you may not have already heard in chapters 1, 2, and 3. However, there may be a few things that were not mentioned in chapters 1, 2, and 3 that will be mentioned in chapters 4 and 5. So let's begin our first slide, public health roles. Now, I know I talked about this in chapters 1, 2, and 3 about the role of public health, how important they are to us, both within our communities at a local level, how they're important to us at a state level, national level, and an international level. So when we talk about public, we pretty much talk about anything that is tied to a governmental role of some sort, and they're used to provide a service to the community. Again, this can be local, state, nationally, internationally. So when you hear about different outbreaks, you hear about different diseases that may have plagued certain countries and is traveling throughout other countries, or let's say for an example, you hear about a strain of flu that may be happening nationally and is moving down to state level and then eventually to local. Let's say for an example, for locally, let's just say for an example, you have an outbreak at a daycare center. The outbreak may be E. coli, or it may be salmonella, or it may just be a nasty bug going around that's causing children to be vomiting and having fevers and headaches. When we have outbreaks and things of that nature to occur, it is CDC that helps to provide that information to us. They have to keep up with the statistical information. That's just like when it comes to anything in a different country. You would want to know from CDC, Centers for Disease Control, you will want to know that a public announcement has been made known to you as a citizen that, hey, over in Jamaica, they have this going on, or over in Dominican Republic, they have this going on. CDC does that. Their job is to provide data to our public health departments so that the public health departments can get the information to us. So you have individuals that work at public health departments. Their job is to on a daily basis, to monitor that type of information coming in so that that information can be made known to the public. This is where you get your statistical information. This is where you get your health information. This is where you get your up-to-date information. It comes to your local department, but individuals at that department interacts with NIH, National Institutes of Health, CDC, to help provide that data to you. Public health simply means the health of a population rather than individual health. So when you look at public health departments, they're not just tied to a specific one person's need. Public health departments are there for an entire community or entire group of body, even to an entire population. So they service different areas and vast number of people. Public health roles can be, as I stated before, bullet number 4, slide 1, local, state, or national level. But essentially, that's all designed for public health. So it's designed to provide information to you so that you can be aware of what's happening at local, state, and national, and how what's happening affects you as a citizen. If it's the water you're drinking, if it's the vaccines, if it's this, if it's that, whatever it is that's tied to public health, anything that is publicly known or made known, we classify that as part of a role for public health. Now, I mentioned a few minutes ago, next slide, National Institutes of Health. Basically, this is the institution that deals with our biomedical and applied research. Now, as you all know, or if you don't know, there is consistently on a daily basis research that's being conducted. Okay? That research may be through the Cancer Center, that research may be through UAB, that research may be through other different type of institutions, St. Jude's. There's always a cure somewhere. There's cures that's being, out now for like cancer, AIDS, sickle cell anemia, multiple sclerosis, just a lot of vast different types of diseases and conditions. Every day, someone is working on a cure. Every day that you're making donations or you're being asked for donations is to help find a cure for a lot of the diseases and conditions that are plaguing our world. National Institutes of Health, they're very instrumental in technology, which means that they work really, really hard with technology as far as trying to find different things that would work for, cancer patients or AIDS patients or, sickle cell patients, different types of technology that will work to help them find different cures. That's what their particular job or position is. Next, we have, as part of the Organization of the Health Services System, we have, as I've already mentioned, Centers for Disease Control. Now, I mentioned them in the beginning because they're closely tied to public health. However, to give you a little bit more specific information about Centers for Disease Control, if you ever hear them classified or mentioned as CDC, they are in relations to each other. So CDC, Centers for Disease Control, they're all the same. It is basically headquartered in Atlanta, Georgia, and it serves several different duties, roles. One of the things that Centers for Disease Control does on slide, and I have it on second bullet, they help promote a healthy lifestyle. How do they do that? By helping you to prevent a disease or an onset of a disease or condition, or let's say you already have the disease or condition, their job is to help you control it. And not just for diseases, but they do the same mechanisms for different types of injuries and disabilities. Again, as I stated before, they work with both the state and local health departments. They also work with academic centers. Academic centers are your teaching schools, okay? You have individuals that actually go to school. A lot of them come here. They come to UAB for school. Why? Because UAB is a research. They do a lot in research. So a lot of physicians come here and intern because it gives them an opportunity to be involved in the medical research that UAB does. Centers for Disease Control also control our national immunization program. And of course, we need our vaccines. Vaccinations is important. So the Centers for Disease Control help us with that program. They help local departments, local public health departments to provide resources to individuals that need vaccinations. Next, we have the Food and Drug Administration. Okay? Now, this is, and you'll know it by its name, FDA. So FDA/Food and Drug Administration, same thing, created in 1906. Now, some of their responsibilities include, number one, they help to monitor the food that we eat. You need that, okay? You need to know before you go and buy a bag of chicken or some hamburger meat or this or that, whether or not it's been infected with E. coli, salmonella, or some other type of bacteria. You need to know that. You need to know what's processed in your food. You need to know what's being processed out of your food. You need to know how your food is being handled. Okay? All of that is done under the administration of the Food and Drug Act. You need to know about the safety of cosmetic products, your makeups, your lipsticks, your eyeliners, any facial or any type of creams and lotions, those are cosmetic products, you need the FDA. They monitor the safety of those different items. They also monitor the safety of drugs, both the ones that you get by prescription and all of your over-the-counter medicines. So yes, I need to know if I have a small baby, no, I don't need to give them this particular Tylenol because this particular Tylenol has this particular side effect and it's causing this issue in this area or this city or this state, and it's got to be pulled off the shelf. I would, as a parent, yes, I want to know that. I want to know that the drug I'm taking is causing deaths or is causing illnesses. You want to know those kind of things. Food and Drug Administration, they got you covered. Not only do they do those things, the safety of food, the cosmetic products, and the drug handling, they also monitor the safety of medical devices, in particular pacemakers. And I just put pacemakers as one of the examples. But if I was a heart patient who had to have a pacemaker, yes, I would want to know that the particular type of pacemaker I'm getting is causing ABCD issue. And I don't need to have that particular one installed. I need to know that a particular pacemaker that I'm having put in has had some defects in other patients, even if it was a small percentage. I need to know that information. So the Food and Drug Administration, they play a vital role in the organization of the U.S. Health Services system. See, the one thing that you all have to understand is that the healthcare system is not a system just by itself. There are several different entities that plays into or that is attached to healthcare. Okay? So you know that you have a medical system, but you got to understand that with that medical system, you have public health tied to that, you have Centers for Disease Control, you have National Institutes of Health, you have Food and Drug Administration, you have all of your biomedical research. All of these entities come together to make the U.S. healthcare system as a whole. Next slide, Health Resources and Services Administration. So what is their responsibility? Number one, they support the development of having strong health services. They support that. A lot of them give grants in order for different academic centers to be involved in research with interns. They give grants for different communities to maybe open up a free health screening session, or they give grants to allow individuals to go back to school for becoming a health professional. They do those type of things, okay? They even provide funding for physicians to go off and have residency training. And that's really great because it gives physicians an opportunity to not only stay within the U.S., but they can also venture out into other countries, see what healthcare is like over there, and be able to provide services to those individuals on a limited amount of time, but through grants that have been provided. Substance Abuse and Mental Health Services Administration. As I mentioned in chapters 1, 2, and 3, when I did that audio lecture, a lot of individuals don't realize that mental illness is a condition. It is a medical condition. So those individuals have to be treated like patients that you would normally treat at a healthcare facility. So mental illness patients also have physicians and trained medical professionals that take care of them and their needs, their vaccinations, their prescriptions, their drugs. Statistics are done on their services as well. They also provide treatment and prevention centers of abuse, whether it's physical abuse or drug abuse, whatever it is that, because, you know, a lot of mental illness doesn't come from a defect that the individual was born with. Sometimes a person may have something traumatizing that happened to them, either as a child or, you know, even in their adult stage, that just caused them to lose their mind. So you have to understand that with that being said, you have the treatment and prevention centers that also help with the mental illness patients. Now that pretty much concludes chapter 4. Again, it was a very short chapter, but it talked about some of the different main components of how the U.S. Health Services is organized. So let's move on into chapter 5. Now chapter 5 talks about managing the U.S. Health Services system. Now I made mention of this in chapters 1, 2, and 3. The first stage in management is planning. This is where a health service system actually sets what their goals are, their mission, their vision, and some sort of an implementing process. This is like the early stages. Next, you have the administration. The administration, as I've stated before in chapters 1, 2, and 3, they are the governing board. They help to make the decisions for what takes place in the health services system and how things are regulated. Everything has to be done through the legal system. Then you have legislation. Every health service is regulated under governmental authority, which means that there are laws and ordinances that have to be abided by. It is done through the legislative authority or legislative department. Budgeting is a significant part of that. It is. Because even though I may want to build a U.S., I may want to build a health service system on 280. That's fine that I want to do that, but that process has to go through the courts. So much has to be done with that because decisions have to be made. Do we raise taxes on citizens? Do we not raise taxes? Where's the money coming from? How much is it going to be for land? What kind of profits are we talking? How much revenue are we talking about generating? All of that goes into a budgeting process, and that too has to be dealt with under the legislative authority. Then we get into the section for management of regulation. Now, that can come through different avenues. Joint Commission is one of the top regulatory agencies in the medical field. Their job is to ensure the safety and quality of care for patients. They do that by way of making sure healthcare facilities are providing the best quality of care. Regulation can come through health departments. Health departments have the right to shut down your facility if it is deemed unfit for patients and their families. They have that right. Licensure is a type of regulation because you need that to operate your facility or practice. If you're not licensed, you can't be in practice. It's more to it than being regulated. You got to get licensed and certified and accredited before you go regulating anything. Okay? Certification. That's required not only for the facility, but any professional, medical professional you have working in your facility. They need to be certified to perform the job that they're performing. So when I talk about different facilities, I have listed in those I gave you some examples: hospitals, nursing homes, you name it. But you got to be certified. A lot of insurances, especially Medicare, requires that as a requirement before they even allow you to start accepting their patients. Your facility, your personnel have to be certified. Accreditation is another way to ensure that your facility and or programs are meeting national standards. So until those standards are met, you can't operate in that facility and be classified as an accredited facility. And you want to be accredited in order for you to continue to be able to operate in that you would like to operate in. Okay? Now, this pretty much concludes chapter 5. Again, very short chapter. In chapters 6 and 7, we start getting into the financial side of U.S. Health Services System. Again, as a reminder, this audio lecture will be available to you in the student portal. The notes are available to you by chapter in Doc Sharing. Thank you.